Have you ever wondered why even the healthiest person can feel fatigued and run down? An unexpected enigma lurks within the human body, affecting millions worldwide. It's a silent condition, often going unnoticed until routine blood tests reveal its presence. Imagine a thief robbing your vitality, leaving you constantly tired, breathless, and pale. Its name? Anemia, a condition where your body lacks enough red blood cells to carry adequate oxygen to your tissues. It might be more common than you think, and it's called anemia. Anemia isn't a disease, but a sign of an underlying condition. Let's take a moment to unmask this often misunderstood medical term. Anemia is a condition that develops when your blood lacks enough healthy red blood cells or hemoglobin. Hemoglobin, a main part of red blood cells, binds oxygen. If you have too few or abnormal red blood cells, or your hemoglobin is abnormal or low, the cells in your body won't get enough oxygen. In essence, anemia is a condition where your body isn't getting enough oxygen-rich blood. This is important because your body needs oxygen to function. Without enough oxygen, your body's organs can't perform to their full potential, which can lead to a host of problems. Now, imagine running a marathon with a small, leaky oxygen tank. That's what anemia feels like for your body. It's struggling to keep up, to keep everything running smoothly. It's a fight that leaves you feeling tired and weak, a common symptom of anemia. But fatigue isn't the only sign of this condition. Anemia can also lead to shortness of breath, dizziness, and pale or yellowish skin. Some people might experience heart palpitations, cold hands and feet, or even headaches. However, it's important to note that anemia isn't always symptomatic, especially in its early stages. Many people with anemia only find out they have it during routine blood tests. This is why it's often referred to as a silent condition. Anemia, in its various forms, affects more than 1.5 billion people worldwide, making it one of the most common blood conditions. It can affect people of all ages, races, and genders, but certain groups like pregnant women and people with chronic diseases are more susceptible. So, while anemia might often be silent, it's far from insignificant. It's a sign that something in your body isn't working as it should. It's a sign that your body needs help. Anemia can be a silent enemy, often showing no symptoms until it's significantly advanced. And that's why it's crucial to understand what anemia is, how it affects the body, and what its main symptoms are. But what causes anemia in the first place? Anemia is a complex condition with a multitude of causes. Let's delve into the 3 primary causes: blood loss, decreased or faulty red blood cell production, and destruction of red blood cells. Firstly, blood loss. This is the most straightforward cause to understand. Our bodies continuously produce blood to replace what is naturally lost. However, when blood loss exceeds the body's ability to replenish it, anemia can occur. This can result from several events, including injury, surgery, or conditions like ulcers and hemorrhoids. Women who experience heavy menstrual periods may also be at risk. The second cause is decreased or faulty red blood cell production. This is a bit more complex. Our bodies rely on a variety of nutrients to make red blood cells, including iron, vitamin B12, and folate. If we don't get enough of these nutrients, our bodies can't produce enough red blood cells, leading to anemia. This is why it's often seen in people with dietary deficiencies. But there's more to it. Conditions like aplastic anemia and iron deficiency anemia fall under this category, where the bone marrow is either not producing enough cells or the cells it does produce are faulty. In the case of sickle cell anemia, the red blood cells are misshapen and break down rapidly. The third cause is the destruction of red blood cells. It's a bit like a demolition site in your bloodstream. Normally, red blood cells live for about 120 days before they're replaced, but in some cases, the immune system mistakenly identifies these cells as threats and destroys them. This premature destruction leads to a condition known as hemolytic anemia. Now, it's important to note that these causes aren't mutually exclusive. For instance, you could lose blood and also have a dietary deficiency, which would compound the problem. Or you could have a condition that both destroys red blood cells and prevents their efficient production. So, you can see that anemia isn't a one-size-fits-all condition. It's a complex interplay of various factors, from your diet and overall health to your genetic makeup. It's also influenced by external factors such as age, gender, and lifestyle. For instance, elderly people are more at risk because their bodies are less efficient at producing new blood cells. Similarly, pregnant women need more blood to support their growing baby, and if they can't produce enough, they may become anemic. Understanding these root causes of anemia is more than just an academic exercise. It's crucial to diagnosing and treating the condition effectively. It's about knowing what's going wrong in the body and finding ways to set it right. So whether it's by replenishing lost blood, correcting dietary deficiencies, or managing conditions that cause the destruction or inefficient production of red blood cells, the treatment of anemia is directly linked to its cause. Understanding the cause is key to treating anemia effectively. In the medical world, anemia is a common subject. It's not just a singular condition, but a family of disorders that affects millions of people worldwide. This makes it a critical area of study for medical students and professionals alike. Understanding anemia goes beyond knowing that it's a condition where the body lacks enough healthy red blood cells to carry adequate oxygen to the body's tissues. It involves comprehending the intricate details of human physiology, the role of iron, vitamins, and hormones in red blood cell production, and the intricate balance that keeps our bodies functioning optimally. Diagnosing anemia is a process that combines clinical acumen and laboratory testing. It starts with a thorough patient history and physical examination. Doctors look for signs like pallor, fatigue, and shortness of breath. They listen to the patient's heart for murmurs that might suggest a heart working overtime to compensate for the lack of oxygen. Following the clinical evaluation, blood tests are ordered. These include a complete blood count, or CBC, which measures the number of red blood cells and their hemoglobin content. In some cases, a reticulocyte count or a bone marrow biopsy may be necessary to pinpoint the exact cause of anemia. There are several types of anemia, each with its distinct causes and treatment strategies. Iron deficiency anemia, the most common type, is often caused by blood loss or insufficient iron intake, while pernicious anemia is due to the body's inability to absorb vitamin B12. Sickle cell anemia is a genetic disorder where the red blood cells become misshapen and break down prematurely. In anemia of chronic disease, a long-term medical condition like cancer or autoimmune disorders can interfere with the production of red blood cells. Each type of anemia requires a unique approach to treatment, making the understanding of this condition a necessity for every medical professional. Anemia is a complex condition with many facets to explore. As we delve deeper into the world of medicine, it becomes evident that understanding anemia is not just about diagnosing a condition, but about appreciating the intricate tapestry of human health and disease. So, we've understood what anemia is and its causes, but how do we treat it? Well, the treatment of anemia varies greatly depending on the type and severity of the condition. One thing to remember is that the overall goal is to increase the number of red blood cells in the body, which in turn increases the capacity to carry oxygen. Let's start with iron deficiency anemia, the most common type. Iron is essential for the production of hemoglobin, a protein in red blood cells that carries oxygen. Therefore, increasing iron intake is usually the first course of action. This can be achieved through diet changes, incorporating more iron-rich foods such as spinach, lentils, and red meat. Iron supplements might also be recommended by your doctor. Vitamin deficiency anemia, caused by a lack of vitamin B12 and folate, requires a different approach. This type of anemia can often be treated with dietary changes and vitamin supplements. Foods rich in these vitamins, like citrus fruits, beans, and whole grains, can help restore the normal function of red blood cells. For people diagnosed with aplastic anemia, where the bone marrow doesn't produce enough new blood cells, the treatment can be more complex. Medications that stimulate the bone marrow to produce more cells, or suppress the immune system if it's causing the problem, might be used. In severe cases, a bone marrow transplant may be necessary. Now, what about sickle cell anemia? This is a genetic disorder that causes red blood cells to become misshapen and break down. Treatment usually focuses on relieving symptoms and preventing complications. This can include medications, blood transfusions, and in some cases, a bone marrow transplant. Finally, let's touch on hemolytic anemia, where the body destroys red blood cells faster than it can produce them. Treatment here can vary widely, from managing underlying conditions to medications to procedures that control the rate of red blood cell destruction. Transfusions, where healthy blood is donated and infused into the patient, can be a treatment option for severe cases of anemia, regardless of the type. This is a relatively quick and efficient way to increase the number of red blood cells in the body. However, it's worth noting that transfusions are usually considered a last resort, due to potential complications and the need for ongoing treatment. It's important to understand that while these treatments can be effective, managing anemia often requires a comprehensive approach. Regular checkups, ongoing treatment, and lifestyle changes are key components of living well with anemia. In sum, the treatment for anemia is as diverse as its causes. From dietary changes to medications to procedures and transfusions, the right approach depends on the specific type and severity of anemia. Remember, the goal is to increase the quantity and functionality of red blood cells and thereby improve the body's capacity to carry oxygen. The right treatment can make a world of difference to someone living with anemia. So let's continue to raise awareness, understand this condition better, and work towards effective treatments. Living with anemia can be challenging, but it's not impossible. It's a truth that many individuals face daily, and it's one that can be tackled with the right knowledge and lifestyle adjustments. A crucial part of managing anemia is understanding that it's more than just a medical condition. It's a lifestyle, and as with any lifestyle, it requires a holistic approach. Let's delve into this further. Firstly, diet plays a significant role. A nutrient-rich diet is the cornerstone of managing anemia. It's essential to include iron-rich foods like spinach, red meat, and lentils in your daily meals. But don't forget about vitamin C, which helps your body absorb iron. Foods like oranges, strawberries, and bell peppers can be your best friends in this journey. Secondly, exercise is key. Regular physical activity can help improve your overall health and well-being, making your body stronger and more resilient. But remember, moderation is key. Overexertion could lead to fatigue, a common symptom of anemia, so find the balance that works for you and stick to it. Regular checkups are also vital. Keep in mind that anemia often goes hand in hand with other health conditions, so it's crucial to monitor your overall health. Regular blood tests can help track your hemoglobin levels and catch any potential problems early. It's not just about managing anemia, but also about preventing further complications. Living with anemia also means being mindful of your mental health. Chronic conditions can take a toll on your psychological well-being, leading to stress or anxiety. So remember to take time for yourself, engage in activities you enjoy, and seek support when needed. Lastly, educate yourself. Knowledge is power, and the more you understand about anemia, the better equipped you'll be to manage it. Stay updated with the latest research, ask your healthcare provider questions, and don't shy away from seeking a second opinion if necessary. In essence, living with anemia is about adapting to a new normal. It's about making choices that support your health and well-being, and it's about being proactive. With the right approach, anemia can be managed effectively. Awareness is the first step towards addressing any health issue. And when it comes to anemia, this statement couldn't be more accurate. Anemia, a seemingly simple health concern, is a complex issue that affects millions worldwide. It's not just a matter of feeling a little fatigued or out of sorts. Anemia can significantly impact quality of life, productivity, and overall health. It's an invisible enemy that creeps up slowly but can take a serious toll if left unchecked. But how do we combat this invisible enemy? The answer lies in awareness. Awareness about what anemia is, its symptoms, its causes, and its potential impact. So let's delve a little deeper into this. Anemia isn't just one disease. It's a condition that can be caused by a variety of factors, including nutritional deficiencies, genetic disorders, and chronic diseases. It's not just about not having enough iron in your diet. It's a multifaceted issue that needs a multi-pronged approach to tackle. By being aware of the symptoms of anemia, fatigue, weakness, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness, or headaches, we can take the first step towards diagnosis and treatment. It's about recognizing the signs and taking action. But awareness isn't just about recognizing symptoms. It's about understanding the impact of anemia on public health. Anemia affects productivity, learning abilities in children, and can lead to complications during pregnancy. It's a public health issue that needs collective action. Being aware also means knowing that anemia is treatable and, in many cases, preventable. It's about understanding that with the right nutrition, medical care, and lifestyle changes, we can reduce the prevalence of anemia. So let's spread the word. Let's educate ourselves and others about anemia. Let's create a world where anemia is understood, diagnosed, and treated effectively. By understanding anemia, we can all play a part in tackling this widespread health issue. Let's start today. Let's make a difference, one step at a time. Anemia might be common, but it's not insurmountable. We've journeyed through the labyrinth of this health condition, unmasking its many faces and exploring its root causes. We've seen its impact on the medical world and discussed a variety of treatment options. We've also touched on what it's like to live with anemia and underscored the importance of awareness. Remember, a well-informed society is a healthier one. With knowledge and awareness, we can all contribute to the fight against anemia.